107.3 KFFM. It is a gorgeous November, and I figured kicking off this month, it's about mental health. It's always about mental health, but it's better to have a mental health professional in the building, and that's where Paul from Comprehensive Healthcare comes in. Paul, welcome.
Thank you.
Now, you've been in the biz for quite some time.
Oh, yeah. I've been doing mental health stuff, substance use treatment for about 20 years now.
Oh, my goodness. Was there an incident that got you into it?
No, it was more serendipity. I don't know that was an actual plan. I just ended up in the right place and worked there for 9 years and then transferred to Comprehensive Healthcare for 20 more.
Dang, so it's been a magical time.
It's been great.
All right. Now, the big question here. I want to know, like the basic question I think everybody has. Where's that line of like, oh my gosh, I'm going absolutely out of my mind, or that's totally normal?
Right. So how do I know when sort of my distress has crossed over into something more serious?
Yes.
And so what we're looking at is how disruptive is this to your normal life? We all feel sad. We all get down. We all have grief and loss stuff. But when you look at, is this impacting my relationships? Is it impacting my job, my schoolwork? That point where it's like, okay, now I'm seeing some genuine impacts and it's not going away. Maybe I'm going to need to reach out and get some help.
Now, a little bit of impacting, that's okay.
Right.
What's the level of like, hey, this is getting, seriously, it's getting out of control?
Yeah, when do we get to the yikes level?
Yes.
And so that's going to vary widely from person to person, because one person's distress over a lost family member, if they've gone through grief and loss before, it may not be as bad as someone that's a fresh case. Or if someone's got some unresolved grief and loss in the past, that's going to bring all that back in the present. But again, what we're looking at is, am I getting out of bed? Am I able to concentrate? Am I able to focus? And yeah, we all have our periods of being down and distressed. But when it becomes a point where, this is really changing how I do things and it's occurring over a period of time, it's worth talking to someone. And that's not saying that, you need serious treatment, but it's always better to intervene early than later.
Perfect. So we've gotten to that point. I pick up the phone.
Right.
Who am I calling?
What are you going to call?
Comprehensive Mental Health?
You can call Comprehensive Healthcare. You can call your primary care doctor. You can call any other counselors in the area. One of the best things to do first is to check if you've got insurance coverage, see who they're going to cover, because it's going to be some financial impact. And so you want to make sure that you're going to the person that's covered by the plan that you have. If you don't have coverage, and then you're really going to look at what kind of resources do I have to pay for this.
And also mentally preparing yourself that this is not going to be the easiest road. You're not just be like, I need help.
Right.
And magically you've got everything laid out in front of you.
Because people don't change when they're comfortable. People change when they're distressed, when there's a discomfort. And so it's not going to be easy. There's going to be work involved. And oftentimes people think they're going to come to counseling. And during those 50-minute appointments, some sort of magic's going to happen. You're going to learn some things. You're going to maybe develop some insights, but there's also going to be practice, some homework stuff that the counselor's going to ask you to do in between, because I'm not going to be able to make dramatic changes in 50 minutes a week, every other week. You're going to need to do some practice and some work in between to really get the full benefit from the therapy.
I think a lot of people too, when they're talking about their mental health and they're thinking, I want a pill. I want that pill that's going to make me happy. Paul, is that how that works? What about medications? Let's talk about it.
Medications can play a really important role in mental health recovery. And for the right person, for the right reason, yes, medications are important. If you have clinical depression and depression runs in your family, chances are you're not going to be able to will your way out of that depression. You're going to need an antidepressant. But oftentimes, if it's anxiety or something else, there are skills that we can do. And oftentimes it's a combination of the medication and the skill building that really causes that person to really advance quickly in their therapy. As I talked about earlier, you have to work to do. But sometimes if you're so depressed that you can't even get to that homework, the medication can provide a strong foundation for you to do the work. It's not going to do all the work for you, but it's going to raise you to a point where you're able to engage in the therapy.
Okay. So work on speaking your truth and being very honest, because if you're not being honest about this process and you're leaving things out because you think, oh, well, they might think that that's really weird.
Yeah.
That might be like the missing key that they're like, oh, it all makes sense now. All right, well, let's work on this to help you on your road.
And the right place to start may be your primary care doctor. Oftentimes they're very comfortable prescribing antidepressant, and oftentimes we're going to want some medical workup as well. Maybe you have a thyroid issue, and that oftentimes mimics depression, and so we want to rule things out too. So getting your primary care doctor on board can really help us work as a team to make sure we're treating the right thing.
Do you have any upcoming clinics or events that you ever have that people, if they wanted to know what was going on, where they could always like check and be like, okay, this is coming up? Or
we have a calendar of events on our website, the cophc.org. We oftentimes have workshops. We have parenting classes. We offer what's called mental health first aid classes, and so those are always posted on our website.
Just like going to school and doing homework?
Darn, yes. You gotta do some work.
Paul, you're telling me that even as an adult, this continues?
That's right. No free passes.
No free passes. But that's life. I mean, that's part of life, and everybody goes through this, and I love that you were talking about everybody has those ups ups and downs. That's
Right.
totally normal. It's going to affect your relationships. That's totally normal. But when it's an everyday having trouble getting out of bed, that's when it needs to be taken to the next level.
And really what we're looking at is a change in pattern. You've got someone that's been normally outgoing, gregarious, and suddenly they become withdrawn. You've got a student that's a good student, they're doing well, and suddenly there's a change in that pattern. So if you have someone that looks like there's been a dramatic change in how they normally do things, again, that's a warning sign that maybe I need to reach out and see if there's something, some support I can get for my loved one.
Now, do you have different courses or classes? I'm not even sure if that's the correct word I'm using for teens and children and adults.
Yeah, so we'll have different track. We've got sort of a kid and family team and then more of an adult team. Kids and family get different training because it's a different interventions with youth and family. And so they have some specialized skills. And we have what are called evidence-based practices, which are science-based, outcome-based treatments that our staff are trained in. And those are going to be different for kids and families than they are going to be for adults. And so some of our smaller sites, Ellensburg, Sunnyside, you might have more of a blend on a team. Here in Yakima, we've got big enough teams that we can have a separate child and family team and an adult team.
Oh, very nice. What would be the website if people wanted to go and kind of peruse all that you have to offer?
COMP, C-O-M-P-H-C, healthcare.org, comphc.org.
And the best phone number, if I wanted to just call in and be like, here's the deal, what do I do with this?
Right. Best number to call to get started is our main number, 575-4084, area code 509. And that's going to get you to our reception. If it looks like you're going to want to start services, they'll transfer you to our intake folks. They'll get some basic information from you, get you set up for an initial appointment.
I love it. And then if you could, being that you've been in this for 20 years, somebody who's really going through it right now and they're struggling, what is a piece of advice or something that you like to tell people, like, hey, you're going to make it through?
One of my favorite sayings is many things are sad and unpleasant, but the only thing that's the end of the world is the end of the world. That you're struggling right now. Yeah, it's difficult right now. You've got some pain right now. We understand that, but it's not the end of the world. People can and do recover from behavioral health issues all the time. It's just a matter of getting connected with the right people, the right resources to do that.
I love it. We're starting off right. We're doing our Mental Health Mondays. We're going to do a check-in every month. So if you're just joining us right now and you're listening to this and you have questions, you're more than welcome to give us a call, 972-1073. You can hit up Comprehensive Healthcare. Give them the address one more time.
Website is comphc.org.
And that crisis line, I've got this one, 509-575-4200.
Yeah, so if you're feeling distressed, you're having some suicidal thoughts, you feel like you're in a crisis, that's the best number to call any time of day, 509-575-4200.
It's got to start somewhere. You are not a tree. You do not have roots. You got this. We believe in you.